invasive procedure with Softrail. Softrail is a catheter that can be stiffened and that has a guiding function. With a stroke, heart attack, intestinal bleeding, or for example narrowing of blood vessels, so-called window shopper's disease, a catheter is inserted through the blood vessels to the location of the procedure. But how does this catheter get into the blood vessel, and how does it find its way through the widely branched vascular system? A needle is used to gain access through a vein or artery in order to insert a guide wire through the hollow needle. The needle is then removed. A short sheath is pushed over the wire together with a dilator. This unique seamless transition from the sheath to the dilator and wire provides gentle access to the blood vessel. The dilator is then removed. The sheath has a hemostatic valve that prevents blood from leaking out. Then a tube, a catheter, is pushed over the guide wire until it reaches the location for the procedure. The blood vessels are made visible on the X-ray with a contrast agent. Now the actual procedure can begin. This can be the injection of a medication to dissolve a blood clot or dilating an artery with a balloon, for example. But it could also be to set a stent. What looks so easy here is often much more difficult in practice. Arteries and veins, the blood vessels, are different in each person. Age also plays a big role. The blood vessel walls can become unstable, expand, stretch, or bend, and with this, many new curves can be created. Furthermore, access may be blocked by arterial prosthesis. To find the way along the curves, doctors nowadays work with a variety of stiff and differently formed catheters. If one catheter doesn't work, then a softer catheter or one with a different form is used. The material is switched until the right catheter is found that provides access. Because the catheter must be a bit stiff to be able to bridge the long distance between the puncture site to the goal, the anatomy must adapt itself. The catheters often shift position when a stent device or balloon catheter is inserted and pushed up to the point of the intervention. Because the tube is not fastened down, it often shifts during the procedure. This can dislodge deposits and make the procedure take longer. This can cause higher risks to the patient, higher costs as well as increased exposure time to radiation. Dislodged particles can lead to strokes. Dr. Alexander von Weymarn's idea was to solve these specific problems. In such critical situations, he thought to himself, "Stupid tube, why don't you just stay bent and stay where you are?" The basic idea for Softrail was born. A tube that can be stiffened at the touch of a button, adjusted to the way it lies within each person's anatomy, and that can be made flexible again when needed. But what changes with the new Softrail treatment? The sheath and the catheter are joined together as one single tube. This means that after the guide wire is inserted, the soft sheath catheter is inserted into the blood vessel via the wire with a dilator. The dilator is then replaced by a soft adapter. If needed, Softrail is stiffened for the first time on the path to the location of the procedure in order to provide support when pushing the guide wire forward at a curve. With difficult curves, the formed wire contained in the set can be inserted into the adapter to guide the soft tip in the ideal direction. When such a point has been managed, Softrail is made flexible again by pushing a button and is then pushed forward. At the point for the procedure, Softrail is made stiff again and set in the desired position. Everything is ready for a safe and gentle procedure. After the procedure, Softrail is made flexible again by pressing the button and is then removed. But how does the stiffening process work? 24 engineers, radiologists and material specialists from Italy, Germany and Switzerland developed this functionality during the past few years. Pressure is used to squeeze a woven layer against the outer layer. This way a framework is created that temporarily connects the layers and thus stiffens them. When the pressure is released, the layers can shift alongside each other, and Softrail becomes flexible again. Switching from a flexible to a stiff state makes it easier to get to the intervention point. Stiffening Softrail results in good backup support at the intervention point, and the doctor can focus on the procedure. With Softrail, these procedures become safer, shorter, easier to carry out, and lastly, also less expensive. The patient is exposed to radiation much less longer. The risks for consequential damage are reduced and significantly less material is used. Softrail for gentle, secure, and successful procedures.